thank the organizers for inviting us to chair this very interesting session. That is the topic of diet. Though we briefly mention the role of diet in the management of diabetes every time, a very detailed and relevant discussion on this subject in the form of a sole conference is well thought of by the organizers. I must congratulate them. This is a very right move and the right time to know the full details about diet, particularly in the management of diabetes. And of course, the diet has got role in various, many situations, conditions, disease states. And as the previous speaker said, lifestyle is nowadays very highly thought of and thought to be the cause for many medical ailments. And lifestyle consists of one of its component as the diet. So diet is a very important aspect, not only in diseases, also in the healthy human beings. So I feel very happy to be here as a chairperson and also listening to the various speakers and enriching our knowledge and your knowledge. Now I give the mic to Dr. Venkataramanappa to introduce the speaker.
Good morning. At the outset, I thank Dr. Parmesh for giving me the opportunity to be here as the chairperson. Well, it is my privilege equally to introduce the speaker, Dr. Bruno Mascarenhas. He had his MBBS from Tirunelveli Medical College, Tamil Nadu, and MCH Neurosurgery from MMC, that is Madras Medical College. At present, he is a consultant neurosurgeon, Tamil Nadu Government Multi-Super Speciality Hospital, and Senior Assistant Professor of Neurosurgery, MMC, Chennai. Over to Dr. Bruno.
Okay, thanks for the nice words, sir. And before I start, I thank the organizers for giving me this opportunity to present this. So my topic is sugar, a white poison. So before we go into topic, I would like to comment upon a point raised by Dr. Paramesh in his lecture. Actually, he posted a study in 2004, I believe, which gave the benefits of the LCHF diet. So now you all must be wondering, in spite of a study in 2004 or in spite of 20 years study, why is our community, that is the medical fraternity, still not embrace this as a whole? Many of you would have having this doubt. I will first answer this question and then I will go into my lecture. Don't worry, I will complete within 15 minutes. Because I am a teacher, a medical college teacher, I know that doctor's attention span is very less. I won't waste your time. I won't test your patience. In spite of the short story, I will complete it. So what happened is, Bill Gates, I hope you all know Bill Gates, once went to a computer exhibition and then he gave a very high-handed statement. He commented on the car industry. He said, if General Motors had kept up with technology like computer industry, we would all be driving $25 cars that got 1,000 miles to a gallon. So what he was meaning is, in 1954, a 1 MB hard drive occupied the entire room. Okay, 20 years ago, we had a floppy drive which should store only 1 MB. Today, we have 64 GB here. So computer industry, computers have been moving at a very rapid pace, but cars are not moving. So he told that car industry is very slow, you guys are lazy. He didn't use the word, but indirectly he meant that you guys are lazy, you are not innovating like us. And he told, if you had been innovating, you would give a car for $25, which would run 100 miles a gallon. And next few days later, General Motors issued a press statement having 10 points. I will just read it. For no reason whatsoever, your car would crash twice a day. Every time they repainted the lines in the road, you have to buy a new car. That's what happens with windows. Occasionally your car would die on the freeway for no reason. You would have to pull to the side of the road, close all the windows, shut off the car, restart it, and reopen the windows before you could continue. And you have to accept this. Occasionally, executing a maneuver such as left turn would cause your car to shut down and refuse to restart, in which case you have to reinstall the engine. Macintosh would make a car that was powered by sun, was reliable, 5 times as fast and easy to drive, but would run only on 5% of roads. The oil, water, temperature and alternator warning lights would all be replaced by a single, the car has performed an illegal operation warning light. The airbag would ask you, are you sure, before deploying. Occasionally, for no reason whatsoever, your car would lock you out and refuse to let you in until you had simultaneously lifted the door handle, turned the key and grabbed hold of radio antenna. They are marking the alt control delete. Every time a new car was introduced, car buyers would have to learn how to drive all over again, because none of the controls would operate in the same manner as old car. And final point is, you have to press the start engine to turn the engine off. So this is a joke, but the bottom line is, computer industry advances at a rapid pace, and even in computer, software advances at a rapid pace, but the reliability is less. The scope of error is more. So anything when it moves at a rapid pace, the chances of errors are more and reliability is less. Now if you go, so compared to a software industry, hardware industry progresses a bit slower but is more reliable. And compared to computer as a whole, car industry, the progress is slow but more reliable. And compared to car, flight, it is even more slower. You see, today you are tracking your Uber and Ola taxi, where they are coming, you are seeing in your app. But still, aeroplanes depend on only the black box. There is no real-time tracking. Because the more important an industry is, the more it is closely associated with the lives, changes come there very, very slowly. And health is even slower than air industry. So even after GPS has come to cars in 1990s, it has not come to aeroplanes. It will take time. Same way, our fraternity is resistant to change. They won't change. There was one man called Ignatius Semmelweis. In 1865, he wrote a paper. Very simple instruction. He told, kindly wash your hands for 10 minutes before doing a surgery. Nothing else. He just asked the surgeons to wash the hands for 10 minutes before operating. He told that the post-operative infection will come down. And do you know how long it took for us fraternity to accept it? It took 60 years. For something as simple as washing hands before surgery, our fraternity took 60 years to accept it. And even today, even after LSCS, low segment cesarean section has come, I know surgeons who still do the classical cesarean, because they are trained like this. So our people are very much resistant to change, and in one way, this resistance saves more lives. Because most of the ideas which come may not be trustworthy. So there is a resistance, there is an inherent resistance, and this resistance in our field is more often beneficial, and this is the reason why even if we have tons and tons of evidences for LCHF diet, our people will still ask no evidence. I am not aware, they will tell. So I would request every one of you not to discouraged by this. And let us move to the topic. I have got 14 minutes left, we will complete it. So since my topic is sugar, a white poison, I will start with the definition of the poison from the Standard Dictionary, which says that a substance through its chemical action which usually kills, injures or impairs an organism. So this is a poison. And what's a drug? A substance intended for use in the diagnosis, cure, mitigation, treatment or prevention of disease. And so there is a definition of poison which says it kills, injures or impairs, as a definition for a drug which says diagnosis, cure, treatment or prevention, and and this is from dictionary, but our pharmacology book says drugs are essentially poison and the amount taken determines the effect. This is from the very famous classic book Lawrence and Bennett. And what this means is that's a very fine balance which is needed to determine whether something is a food or something is a drug or something is a poison. It is as difficult as this elephant standing on a ball. And even a slight increase in the dose makes the drug work as a poison. Classical example is the most potent toxin which is in the world, that is the botulinum toxin, is used as a drug. And any drug, if you are giving in an overdose, can kill the patient. So, what we have learned so far is the scale is tilted by the dose, but unfortunately it is not only the dose which determines whether a particular chemical works as a drug or a poison. There is something else. This is an enzyme. This is a N-acetyl transferase enzyme, and this is isoniazid, a famous drug for tuberculosis. So, what happens is isoniazid is acetylated by this enzyme and it undergoes the metabolism. So, what they found it out, there are two types of people. Some are called slow acetylators and some fast acetylators. So, some people take isoniazid, they acetylate very fast, the metabolism is different. Some people take the same drug, same dose, it acts differently. So, the bottom line is, what is the dose which determines whether something is a drug or toxin varies from person to person. And this is what I believe the previous chairperson stressed in his final remarks. So, there is no one solution fit all. The same amount of sugar which one person's body will tolerate will act as a poison for the next person. And so, this picture I believe was also used by the first speaker, but in a different context. So, here also, so what I have made is the balance is not tilted by only one thing. If any of these four, any of the stones, even if one stone is a little overweight, it tilts the balance. So, what are the stones involved in determining whether something is a drug or a poison? First, it is the nature of the substance, which I have already seen. Second is the genetic makeup of the situation, individual, which I have just discussed with the example of the acetylation of INH. And third is what I call a situation. We will explain this later. So, this is nothing but the epidemiological triad we learnt in SPM called agent, environment and host. So, agent in this case is the INH, host in this case is the human body, which is the different forms of enzymes, and environment is the situation. So, basically the problem is most of the diseases we will understand it well if you read biochemistry and SPM. Unfortunately, those are the two subjects which are dreaded during MBBS for medicos. So, I confess, I understood biochemistry only when I started preparing for my PG entrance exam. Only after completing medicine postings, only after completing the internship, only after managing a DK in the ward, this made sense. And SPM I learnt only after my work in PhD for 3 years. So, there is nothing wrong if a young medico is not interested in this, but we have to somewhat cultivate the habit. So, whether something acts as a drug or poison depends on 3 factors: nature of the substance, the genetic makeup of the individual and the situation, which is the agent, environment and host triad we see. So, 9 minutes left, we will rush. So, coming to the sugar is a poison if it is taken in large amounts. Unfortunately, what is large varies from person to person. And if it is taken in persons who are genetically susceptible and if taken in certain conditions, again what is large varies on the same person from day to day. So, what happens with the sugar is a poison? What does it cause? It acts both as a rapid poison, causing acute effects like DKA, diabetic ketoacidosis, or hyperglycemic hyperosmolar coma, or a slow poison with chronic effects which classically we divide into vascular and non-vascular effects of diabetes. So, fast poison, that is DKA and HHS. Since there is a time is running short, I will just skip through these slides. Since most of you are diabetologists, I think a neurosurgeon need not explain this to you. Let us come to something interesting. Now, let us see the same DKA, you all know, diabetic acidosis, for the same person can occur when the patient is running some other illness like fever. This is what is called the environment or the situation. The same amount of idli he will take, he will tolerate every day. One day the same idli can bring him to DKA because he had another concurrent stress. So, coming back to the point, substance is important, dose is important, what else is happening to him on that day is important. So, let us skip through the DKA and HHS. Coming to the vascular complications, how sugar acts as a poison in vascular? It can be a microvascular or macrovascular. Microvascular is the retinopathy, neuropathy, nephropathy, and I think it is here right now in the logo of the Bangalore Diabetes Center itself is there. And macrovascular is coronary heart disease, peripheral artery disease, cerebrovascular disease. Okay, leave it. And one of the key important complication in a non-vascular is the obesity related. So, this increased sugar in a particular person causes obesity, which in turn opens up a spectrum of diseases about which we are more interested. So, as we know, insulin is a very essential hormone and it has so many functions, and of which you see there are 4 functions happens in a adipose tissue: decreases lipolysis, increases FA synthesis, increases triglycerides, decreases ketogenesis. In short, insulin in adipose tissue produces fat. Very simple. Insulin inside adipose tissue produces more fat, and insulin in other tissues has its own functions. So, insulin acts through. Now, what happens when there is more fat? A person, suppose a person is 60 kg, 65 kg and he has 5 kgs of fat. This 5 kgs of fat produces more fat, because only insulin produces fat inside fat. So, if a person is having only 5 kg of fat, a small amount of fat is synthesized. But if the person is having 10 kg of fat, there is more space for the fat synthesis to happen and more fat is synthesized. So, let us assume a dam, and you see the dam has a dam gates, and the water flow depends on 2 factors. One is the size of the gate and second is the extent of the gate opening. Now, assume there is a large gate, and if it is opened fully, there is a high water flow. A large gate opened little has a moderate water flow. A small gate opened fully has a moderate water flow. A small gate opened little has a less water flow. So, in the same way, if a person has less fat in his body, when more insulin is available in the blood, there is moderate fat synthesis. A person has less fat in the body, when there is less insulin is less fat synthesis. A person has more fat in the body, and when there is more insulin, there is very high fat synthesis. And we all know that insulin increases if there is an increase in glucose and reduces if there is less glucose. So, in one single way, the amount of glucose level in the blood determines the fat synthesis in the body. And what happens is, when more and more fat is synthesized, the size of the gate, the more and more gates are introduced to the dam, and the water flow increases. So, this produces a vicious cycle. Insulin produces more fat produces more fat, and the person goes on obese. And what happens with more fat is it creates a vicious cycle. In addition, there is an aromatase enzyme in the fat which converts testosterone to estrogen, and testosterone is the second hormone other than insulin which produces fat. So, over a period of time, when the patient goes on producing more fat and goes to obese, and it starts the problem of obesity like spine problems, joint problems, etc., and even a relative hypothyroidism. And over a period of time, when more and more fat gets accumulated in the body, all the insulin coming in the blood is used by the fat, and there is no insulin available for the other tissues. So the blood sugar levels increases up. As a response to this, more insulin is secreted, again a vicious cycle. So what happens when you put on a bore well? Initially you will get a lot of water, but over a period of time the source will dry up and you will end up like this. Same way, this fat in the body acts as a bore well. It sucks up enough insulin and doesn't allow the insulin to go to the other essential tissues, and over a period of time the pancreas dries up like this. So our solution is close the bore well. How are you going to close the bore well? We saw that fat in the body increases if there is more synthesis and reduces if there is more synthesis. Fat synthesis depends on insulin and fat, and we can change both. So how to reduce fat synthesis? Either you can reduce the total intake by starvation, or reduce fat by liposuction, or reduce insulin level, or increase utilization by exercises, increase utilization by gluconeogenesis, or increase utilization by uncoupling of oxidative phosphorylation. And what we do in the LCHF diet is we operate at all these levels. What we do is a chemical liposuction, and we reduce blood sugar, we increase the utilization by gluconeogenesis, and increase utilization by uncoupling of oxidative phosphorylation. So as we all know, coming back to evolution, what was once considered as normal is later considered as abnormal. 100 years ago, tobacco was normal. There were various forms in which we consumed tobacco, not just sugar. Even there was something called a snuff, the chewing, everything was there. Today, tobacco is considered as something which is injurious to health. So the take home message is sugar consumption is injurious to health. That's all.